Coming to the route of treatment, so we have both the oral route and the rectal route. And one thing we should remember that rapid reduction of fever is not necessary. So if the fever is high, a drop in temperature could take 1 to 2 hours, and our aim is not to normalize the fever, it's to reduce it and to prevent it rising. So if it is a high temperature, obviously we don't want it rising more. It can make the child more uncomfortable. The child may develop chills and so on. So you want to prevent progression of the fever, but a little fever, as I said, helps you to fight the infection. So your aim is to reduce it and avoid progression. It's not to keep giving the medication to maintain a normal temperature. And remember, if you overdo treatment, baby child may get cold. So sometimes we get a temperature of 35 or 35.5 after you have given the medicines, because sweating is one of the responses, and cooling happens with evaporation, and the sweating evaporating causes the body temperature to drop. Oral treatment is preferred because it's a natural way of giving any medication. It's quite effective. It acts within half an hour or so, and it is adequate in most instances. Injections are restricted to patients in the intensive care who are unable to take orally and you want a rapid decrease. The suppository form is an alternative option. It's safe to use, but at the same time, remember that it's not going to be too comfortable. It's not a natural route. Nobody likes to be poked through the bum, and the same applies to your child. They may not complain again. They trust you as a carer and they expect you to do the right things for them. So remember that a suppository is convenient. Obviously, you don't need to beg the child to take it. At the same time, you get into the habit. The parents feel that the child doesn't take the oral medicine or he spits it out, and then they go for the suppository route on a repeated basis. So remember that even psychologically there is an anal complex. The child between 1 and 3 years is quite sensitive about the anal area, and we don't know about what self-confidence issues will produce in them if you keep using the suppository route. In Western countries where we have worked, most of the centers use suppository only for emergency. Unfortunately, in the UAE, quite a lot of pediatricians prefer the suppository route, and the parents stick on with that. So this is an appeal to both families and pediatricians who are watching this. Suppository route is not any different from the oral route in majority of the instances. If we do argue that the child doesn't allow oral medication, the approach is due to poor parenting at the start. So we need to start early with the right response to the child's reaction, similar to what we discussed under picky eating. I would refer you to watch the video on picky eating as well as the video on discipline for you to understand that we do need to start young. If the child starts opposing, starts throwing tantrums, and you are caught between a tantruming child and treating the fever, you may end up taking the easier route. But you start right from the beginning, then it's easier. Use a suppository only if the child is sleeping or repeatedly vomits oral medicine and the child is significantly having fever. So unless it's a significant fever, you don't need to treat it again. Consider using a lubricant like petroleum jelly externally before inserting in the anal opening. This is the shape of the suppository, so the pointed end is to go into the anal opening, and a lubricant is useful. Keep it in the fridge so that it's firm when you use it, and you can hold it for 2-3 minutes outside so it starts smoothening. So in that case, you may not need the lubricant. Hold the thigh together for a couple of minutes after inserting, because if you release the thigh, the child may push it out and then it doesn't help. And remember that the formulation is the same as for the oral medicine. So if you have given the rectal route, the next dose of paracetamol, whether you give it orally or rectally, should be after 6 hours. So it is counted as a dose, and don't be confused. Don't think that this is a different medicine. If it's paracetamol suppository, it's the same medicine as the oral.